Welcome back to GEMS Podcast. I am the host and founder, Miss Genesis Amaris Kemp, and with me today is Dr. Rob Barkett. He graduated from Purdue University, Thompson Jefferson Medical College in Philadelphia, and completed his internal medicine residency at Riverside Methodist Hospital in Columbus, Ohio. He is a board-certified physician who has been in private sector for 29 years, serves as medical director of a nursing home and a thriving hospice agency. He's also the author of Simple Medicine, No More Google Searches. And without further ado, we're gonna figure out and learn why he wrote the medical reference guide of the most common medical problems and complaints that he's seen in 30 years. And without further ado, please welcome Dr. Rob Barkett.
Well, thank you so much for having me today. And I'm real anxious to get the word out on my book. I think it's the only medical reference guide that's written for layman people or anyone with a 8th grade education. It's written in almost a very Cliff Note version to make it very easily understandable and written so anytime there is a medical problem or complaint, you can go to it and there's one page that can hopefully prevent you from jumping off the cliff with one of your medical problems.
Wow, and that is needed. I think they should keep those in the hospitals like back in the day when they kept dictionaries and encyclopedias, because sometimes like the doctors, you guys talk to us with these enormous words and I'm like, can you just break that down into layman terms or break that down to a person with a supply chain degree so we can understand? And, it's kind of hard for patients who don't have anyone in their family that's in the medical field that they could go to ask questions or etc. And I feel like sometimes whenever you have a bridge in communication or a communication breakdown, sometimes the doctors are saying certain things to the patients, but the patients are hearing something otherwise. So then it doesn't help with the treatment plan. So can you talk about your experiences there? And was that your main focus when you wrote the medical reference guide, or what led you to writing it?
Well, that is a great question. My father was an internist, and so I grew up kind of in the medical field. And then when I became a physician, I knew I was speaking English, but the patients were listening to Chinese. So as long as I was talking in there and they would appear to nod their head and to understand, I knew by the time they left the office, they had really no idea what I have said. If it, trying to explain a common blood test or a urine test or the test I am going to run, you mentioned some words which in cancer, I'm looking for cancer and everybody's head just starts spinning. And I have been a patient now multiple times myself, and I follow in the same trap. I go into another subspecialty and sometimes I hear is blah, blah, blah. And I'm like, oh my gosh, because you're scared, you're going to have surgery. And so I've been a patient, which helped me become a better physician. And really, I try to talk to my patients, and we have families of patients here, generations. There's been a Barkett practicing medicine since 1967 here in Mansfield, Ohio. And I know I don't do a good enough job explaining and in layman terms, and there's no book out there for the patient. So that is why I think everyone who has a legitimate interest in their own healthcare should have this guide next to them. So when they do go home, they look up diabetes or they look up hypertension or they look up their problem, it's easily referenced and they can understand it a lot better.
Beautiful. And since your book has been out on the market, Dr. Barkett, have you tried to give this book to other physicians that are within your network to let them give you feedback or them to advertise it to some of their patients?
Absolutely. And actually had one of my colleagues proofread it for me, and he noticed a few things because you write this and read it and go over it and over it, and you miss some things. And I had really good feedback, and I have some physicians here in town that I gave copies to, and I received very good feedback there. And then I went and I've given it to not only doctors to put in their waiting room, but dentists. And the dentists seem to really like it because there's a little waiting time there, and I've gotten good feedback from the dentists and their patients. And then there's my residency program in internal medicine at Riverside Hospital is an old attending of mine, Dr. Bose, and they have a huge private practice group of internal medicines, and he distributed those to those doctors to put in their waiting rooms.
And I like that you guys are circulating the book around. And I also like the fact that you allowed another physician to proofread the book, to just have a cold eye review, to also give you some feedback on maybe something that you may have missed or something that was not easily digestible, or etc. So whenever you think about the feedback that you've been getting from the book, what are some of the reoccurring feedbacks that you hear?
Well, most have said it's very easy to understand. Most have given it to a family member, given one to a family member. They say it is a quick read. Some have said they have felt my frustration and of being a doctor now in 2022 than it was being a doctor in 1990. And they felt it was concise. They are able to go back to numerous problems. If you don't have a problem with diabetes, really, why do you want to read that section? But, whenever there's a problem that they have, or cancer screenings, or a medicine that I've given them for their problem, they go back and review it. And even sometimes here in the office, I read the section that I've already gone over to make it simple to the patient while they're in my office. And I really feel like it's an extra set of care that I am giving to them.
And it makes it more personable, because I think it helps build a relationship better with you and your patient when you do that, because you give it to them from a physician standpoint, but then you also whip out your book and give it to them in a simple medicine format as well, to make sure that you are bridging the lines of communication and there's nothing left unsaid that could, cause the patient to feel as if they're not necessarily being heard.
Correct. And that's the main thing too. Like the patients, they will talk a long time. Some problems they talk a lot, and I know it's very benign. And then maybe I'll go do something else, and they may say, "Well, geez, you just blown me off," And it's good. So when they leave, that we talk about it. I'll reiterate what they thought their biggest problem was, and I'll say, "Hey, it's really not that much. It's just this or that," and they do appreciate that because they know they're being heard. And that was another main reason I wrote the book. It's been well known that people who have increased education, or increased literacy in their own healthcare, it's proven to increase outcomes for those patients. And that right now has been the biggest feedback. And that's what I'm really most proud of right now.
That is incredible, because when you are knowledgeable about what's going on in your body, what are some of the ways to overcome it, and then you begin to do it alongside with your doctor, because I always say your physician and you should be in partnerships, because it's teamwork. You listen to them, but they also need to listen to you, because one of the things that some people have told me who have battled cancer or autoimmune diseases is they feel like physicians aren't hearing them whenever they're bringing up certain issues, and they're like, just take this medicine, just do this, just do that. And some of the medicines may not work, they cause side effects and etc. So what are your views on holistic medicine along with Western medicine to complement the two of them?
Well, I have to say, through the years, I've become much better at holistic. I used to kind of poo-poo it. I wanted to go with all science-based facts and what we learned in medical school and what we learned in residency. But throughout the years, there's no one way to the body. It can be treated by one method or the other. It's like you say, it's a whole gamut of things. And I've, went to telling my son how bad, even this is different, marijuana was. He had a little affection for that. And to now I have the certificate to recommend, marijuana. So one of like 600 doctors in Ohio. I am very big on chiropractic medicine, rehab, vitamins. That's probably from my wife. She does all the reading and all that. And I am open to anything that can help each individual.
I want to dive a little bit deeper there, but before I do, so is your wife a physician as well?
She's not, but she's very big into healthcare, yoga. Oh my gosh, makes me diet the way I've never dieted before. I was a meat and potatoes guy. So, but no, she's very big into fitness and healthcare. And she does work here in the office.
Okay.
But she doesn't have training in that, but just on the go.
She wants to make sure you're around for a long time. So
I can't believe that, but that's what she says.
Oh man. So you mentioned the marijuana, which I know medical marijuana, like I'm in Texas, so we don't have that here yet. But I do know that there is a friend of mine who her son suffers with seizures and epilepsy. So
Right.
she drove all the way to California to do the medical marijuana for her son, and it has actually helped. And then you talked about chiropractic, and another thing that I use is acupuncture, because when I got in an accident, acupuncture was very helpful for me. And then at the end, she would use a CBD slab, but she refused to sell me the slab. But I tell you, when she put it on my back, it was better than Icy Hot. It was better than Bengay or BioFreeze, and it was just so helpful. So can we talk a little bit more about medical marijuana, chiropractic, and maybe some of the Ayurvedic remedies that you've seen that have worked for some of your internal medicine patients without, releasing any proprietary information?
Yeah, I've been doing this probably 2.5 years now, and you do learn on the go. And at first they came from marijuana. They came out with like 19 indications, and now it's up to 24. And then Ohio reviews each year other indications for its use. And I've seen significant improvements in people's chronic pain, people's anxiety, people's post-traumatic stress, seizures, fibromyalgia. And those are probably the most common reasons that I have prescribed it. And they go to the dispensaries, and they basically, it's a trial and error, trying to see how much the THC or how much of the CBD or combination, or if it's the indica or sativa, and they become, more educated actually in it than I am. And like you mentioned, acupuncture, that's been a great way around here to help people quit smoking, and the old in chronic pain. And when anyone anymore has a neck pain, a back pain, and I go to the conservative measures of ice and heat, Tylenol, chiropractic manipulation, physical therapy before I even start doing any x-rays or any injections or any further treatment like that. It's a team effort.
So now let's talk a little bit, and I like that it's a team effort. You mentioned that it helps fibromyalgia and some of the other problems you mentioned, but going to a medical dispensary, because I know some of the medical dispensary, some of the grades are worse than others. So how can you ensure that the patient is getting a adequate grade that is helping them? Because you don't want something that's laced with, some garbage or whatnot. So is there a way that you guys could not only prescribe it, but also have like a certain grade in your office so you can make sure that it's consistent across the board? Or does it not work like that? I'm just asking to get clarification.
Yeah, it doesn't act like that at all. They've had increased amount of dispensaries, and they were in the bigger cities in Ohio. So at first, there was Cleveland, Columbus, Cincinnati, Akron, really none in our area. And now there's like 37 dispensaries, and they're all the State Board of Pharmacy, the medical board, Ohio State Medical Board. They're under their control. And for me, as someone who advocates it, it's faith and faith only. And I tell them when they go there, start low and go slow. But we don't have any idea. We're hoping it's pure. We have faith they'll get better, but that's all we have.
Okay, start low and go slow. And then one of the, I'm just asking because these are some of the questions that others have brought up. So they said there's the regular marijuana, but then I think there's like liquid. I don't know about that. Is there like some type of liquid or something?
Yes.
What's the difference?
There's different ways you can use these. Don't smoke it, but you can use it in a vape. And then there's rub it on or topical. And you get gummies, patches, pills, but you're talking about a tincture where you can do drops in your mouth. And I let the patient, I defer to them to see which way they would like to have it.
Okay, so you give them the flexibility there. Thank you for elaborating on that, Dr. Barkett. And early on, I mentioned that you talk about the 30 common symptoms and problems that people come to you for. Can you list those 30 problems? Maybe you can list all 30 of them, or maybe some of the top ones, maybe the top 15 or something, just so we could be on a on alert on what some of those problems can be, because if we're not seeing these things, or we fail to look at certain clues or things that are going on with our body, because not everyone is intentional on paying attention to how their body speaks to them. And I think whenever you don't pay attention to how your body speaks, and I'll give an example, like for example, if someone consumes some food and then they notice that a few hours after eating that certain food, they have stomach aches or tightness in their stomachs or cramps. Maybe it's a GI issue that you should get looked at, or maybe it's your body telling you that you cannot tolerate that food. And then so some people will refer to the blood type diet, where you eat according to your blood type, and that should help you correct some of the problems that you're having.
Well, the most common, problems I see would be headaches, chest pain, acute abdominal pain or chronic abdominal pain, low back pain. And then the most common conditions I see by far is diabetes, hypertension, atrial fibrillation, heart failure, depression and anxiety, dementia, and would be by far the overwhelming most common problems and conditions that I see on a daily basis.
Sorry, I was talking to myself. I was on mute. So with those common types of problems, do you think any of those problems can be reversed with proper diet and nutrition?
Oh, absolutely. I mean, for the majority of people, say with diabetes or hypertension, even, for people like anything, prostate problems in men, decreased risk of cancers, it all boils down to following a proper diet, somewhere between 2,000 and 2,500 calories a day. Make it a low salt diet. Really increase your fruits, your vegetables, your fibers, your legumes and nuts, and really decrease what we all love. I call them the 4 Ps in my book. And people say, well, these 4 Ps, that's all my food groups. And P as in pasta, P Panera bread, P potato, P pastries or sweets. And if you can eliminate those or modify those and get more fish and chicken and still throw in a little red meat here and there every week, everyone's would be much better health, and I would be prescribing a lot less medications.
Yes. And speaking of medications, I have had a problem with some of the pharmaceutical companies, but this is not to bash on them. It's just a personal preference. And I feel like some of the pharmaceutical companies, they offload certain medications to the doctors, and the doctors have to give some of those medications to the patients because quotas and et cetera. But do you feel like those medications, I know some people actually need medications, but there are alternate routes than just taking medication, because if you take a certain medication, then it gives you a side effect, they give you another medication to mask that side effect, and before you know it, you're a pill popping zombie walking around here.
Well, most of my patients, even from my dad to myself through the years here, they know we don't push medicines. I mean, if you're sick for a day or two, we're not giving antibiotics. That's viruses. It pisses some people off. They come and do a copay, and I won't give them anything. I feel less is always more. And when I see new patients that come from referrals from other doctors, or they just, through word of mouth come here, or I see in the hospice setting, or when patients come to the nursing home, the majority have polypharmacy. They're on way too many drugs. And there could be on two of the same type of drugs. And these doctors just add medicine and add medicine. Like you said, they have a side effect of medicine and add another medicine. So I strip them. I strip them down to what, really I feel is the main ones. I tell them, don't throw away your medicines. We may add them back, but we will do that at a slow process. And I'm just not a big medicine guy, but do it when I have to.
Thank you so much for sharing that, because I know some doctors get really upset when I ask that question, but I was like, hey, I've seen it with my dad, and we've told some people, hey, this medication doesn't work, and some people are just so bold, if you don't take it, you'll just die. I'm like, no, there's other ways. So with you focusing on internal medicine, has this always been a passion of yours, Dr. Barkett? And if you weren't doing internal medicine, would there be another form of practice that you would go into outside of the hospice and some of the other things?
A very good question. I think, from a young kid, and my father making rounds, and there was no specialist. And so every weekend I'd make rounds with my dad, and I just felt a community back then of dad knowing all, the other doctors, the nurses, and then going to the city schools here, knowing the families. I really thought that was my calling. In residency, though, I really was drawn to cardiology. But then I saw the lifestyle these cardiologists had. I knew I wanted to raise a family, and I knew I wanted time out of the office. And so I went back and just did my 3 years of residency and started practicing with my dad. But those days are over. I just want to get that clear. Everybody has a subspecialist. They basically kicked us internal medicine doctors, family practice doctors out of the hospital setting. They now have hospitalists. And so because I'm never in the hospital setting, I don't meet any of the new cardiologists or infectious disease or pulmonologists, gastroenterologists. I don't meet them. I don't have that personal relationship as I do with the rest of the dinosaurs here at my age in this town, which we did so much together. And when you don't have that personal friendship, then communication breaks down. And that's another thing I go in the book. I mean, there's no longer see you in the hallway, a short conversation, a short note, a phone call, forget that. And it's very frustrating. And, at this point in time, would I go back into medicine again? I don't know.
Thank you for being open and honest there. And as we begin to wind down, Dr. Barkett, I want you to leave our listeners and viewers with your call to action for this segment.
Well, my call to action is actually hopefully the patients become more educated on their own problems and their own chronic diseases. Also, to look at the book and know, are they getting the appropriate vaccines are recommended? Are they being recommended the appropriate cancer screenings? And then if they are being treated treated for a chronic condition, look at my book and see there's 9 ways to skin a cat, but this is standard of care. And if they must challenge their own doctor, because the patient is their own advocate. You have to be your own advocate. And not every doctor's built the same. Some are younger, some are older, some aren't keeping up. So challenge your doctor, become literate in your problems, and you will have better health outcomes.
Amazing. Yes, you definitely have to be your own self advocate out here because no one knows how you feel. The doctors can only give you recommendation based on the lab works and the chart stuff that they see, but they're not in your body to feel for you. So make sure you speak up and do it in a partnership way with you and your physician. And Dr. Barkett, for anyone interested in connecting with you further, please share your website and where you hang out on social media.
All right. Well, here's my book. You can see my book. I don't know. Oh. So my book is on my website is simplemedicinebook.com. And this book can be at every Barnes and Noble or online with Amazon or PAL or Indigo, or just go to Amazon, hit Simple Medicine, and you can buy it with one click, and it's all yours for $17.95.
Amazing. And are you on any social media platforms like Instagram, Facebook, Twitter?
I'm on Facebook, but it's just more personal. I'm just launching the advertising campaign, which is something I didn't know how hard it was. And I appreciate you getting me on this, my first podcast. I appreciate you taking the time and having me here. You had very insightful questions, and I'm on but I haven't really. The campaign of advertising is an ongoing process.
Okay, so I will make sure the show notes will definitely have your book. So simplemedicinebook.com by Dr. Rob Barkett. All of his contact information will be in the show notes. So you could go out and grab a copy of your book so you could be knowledgeable when you're going into your next physician visit. And until we chat next time, peace, love, and lots of blessings. Remember to subscribe and share this podcast. We're on 40+ platforms. Follow us on YouTube at Gems with Genesis Amaris Kemp for all things video content. And also write us a review. I want to know what you like, what you don't like, and any topics you want to hear. I always believe in connecting with my audience because if I'm not learning, I'm not growing. And I'm here to educate, inspire, and motivate. And you could also donate to the podcast mission to help with lighting, sound quality, and etc. via Venmo or anything else. So just go to genesisamarisKemp.net to find all information. Until we chat next time, ciao.